Hello, everybody. Thank you so much for joining us for today's Reviving Veterinary Medicine webinar. It is my honor and pleasure to be here with all of you today to discuss such an important topic. Before we get started, I want to just go through a few housekeeping items. The first is that I want to acknowledge that this webinar is sponsored by Reviving Veterinary Medicine. We are a platform aimed at improving the mental health and well-being of veterinary professionals around the world, and we do that via free resources and webinars like these, as well as coaching, critical incident debriefing, lunch and learns, and more. Check us out at revivingvetmed.com or follow us on social media at revivingvetmed. Now, a quick reminder that this webinar is approved for 1 hour of CE credit from the Alberta Veterinary Medical Association if you do attend live. So if you stay with us for the session, you will be eligible for your credit. As we get started, just a few housekeeping items. Everybody is muted as this is a webinar presentation. There will be the opportunity to ask questions. You can do so at the end by unmuting yourself, or you can ask those questions in the Q&A in the webinar settings below. And we will dedicate time at the end to address those questions. If you have anything else that you would like to reach out to me about personally, I will be sure to share my contact information at the end as well. I will be your speaker for today. I'm Dr. Marie Hollowaychuk, and I am excited to dive into today's session. So the title of our session is Creating Hope Through Action, Suicide Prevention in the Veterinary Profession. And this is such an important topic. It's one that's very near and dear to my heart. And so with that said, I'm really excited to go ahead and get into it. So today is a special day amongst us in our profession, and certainly amongst those of us who work in the mental health and suicide prevention advocacy space, because today is World Suicide Prevention Day. We are going to be talking about suicide in today's presentation, and it is likely that many of you and myself have been touched by suicide at some point in our life. So I want you to know that help is available. You are not alone. If you are a survivor or if you are yourself struggling, please speak with somebody today. If you are here in Canada or in the United States, you can call or text 988 24/7. And for those friends joining us outside of Canada and the US, you can visit findahelpline.org to find a suicide helpline in your area. Now, by the end of our time together today, I hope that we will have been able to describe the global and veterinary specific suicide statistics and the importance of awareness to be able to recognize warning factors, risk factors, and protective factors related to suicide, to apply specific communication techniques to support those colleagues, clients, friends, and family members who might be at risk, and to identify those evidence-based suicide prevention resources available both locally and globally. So covering a lot of important information today. So I want to remind everybody today that this information about suicide prevention is for everyone. It is not just for those of us in the veterinary profession. And I say this because suicide impacts everybody. In the United States, there is approximately 18 per 100,000 deaths that are because of suicide among working age adults. This, unfortunately, is the highest rate that it has been in decades. It is 33% higher than it was in 2001. In Canada, the suicide rate has remained relatively stable, although it has fluctuated slightly over the years and sits at about 11 suicide deaths per 100,000 deaths among working age adults. Very surprisingly, perhaps to some, suicide is the second leading cause of death among young folks and young adults, and that is second to injuries, accidents, and trauma. So I want to be clear that there are many populations that are at risk of suicide. And I mentioned youth and young adults. Unfortunately, there are rising rates of suicide among youth and young adults here in North America. Also, older men. Older men have the highest suicide mortality, meaning there's the highest number of completed suicides among men who attempt suicide. We also want to acknowledge our Indigenous communities, especially here in Canada. There are disproportionately higher rates of suicide among our Indigenous communities compared to others. And as I mentioned, there are gender differences. So in men, we do see higher mortality rates due to suicide. In women, there tend to be more attempts and more self-harm hospitalizations. So many women attempt suicide and do not die by suicide. And so let's relate this now to the veterinary population. So we do have some research specifically among Canadian veterinarians, not necessarily with completed suicides, but when it comes to thoughts of suicide. There was a voluntary survey study that was performed a couple of years ago out of the Ontario Vet College that surveyed more than 1,400 Canadian veterinarians. And they found that over a 12-month period, the rate of thoughts of suicide was 26%. So this was much higher than the national average, which ranges between 2 and 10%, depending on the general population that is studied. So quite a significant number of Canadian veterinarians experience thoughts of suicide, and we do not yet have statistics specifically around rates of suicide among Canadian vets. We do know, though, among US veterinarians, at least based on research from 1979 through 2015, that male veterinarians are 2.1 times more likely, and female veterinarians 3.5 times more likely to die by suicide in comparison to deaths over that time period within the general population. This study also showed that female veterinarians working in non-clinical roles were particularly more likely to die by suicide compared to the general population. And that in between the timeline of 2000 and 2015, 1 in 10 deaths in general among female veterinarians were attributed to suicide. And so I think it's important to highlight, and I'm going to be dispelling some myths that have come up over the years when it comes to talking about suicide, not just among veterinarians or veterinary professionals, but in general. There's oftentimes a sentiment that is shared that veterinarians have the highest rates of suicide among all professions. And I want to share with you that this is not true information, and this hasn't been true for many, many years. There was some research done close to back in the early 80s, even potentially into the early 90s in the United Kingdom, that did show that veterinarians were among the occupations with the highest rates of suicide. That has since changed dramatically. Veterinarians no longer fall into that category. And according to the information that we have from the CDC US National Reporting Systems, the most recent being reported in 2021, the highest rates of suicide among occupations are first and foremost construction and extraction fields. That includes both male and female. Farming, fishing, and forestry, predominantly male, deaths by suicide in that occupation. Personal care and service. So these are our esthetician folks, hairstylists, other people within the service industry. So restaurant businesses and so on. That includes male and female. Installation, maintenance, and repair among male and females. And then arts, design, entertainment, sports, and media, again, among males and females. So these occupations tend to have much higher rates of suicide in terms of the number of suicides that they see on an annual basis among those working in those fields. Now, I do think it's very important when we talk about occupations that one of the biggest things that can relate to suicide is the access to means within our occupation. And so this was one of the biggest research studies that was published looking at access to means of suicide and occupation and the risk. This was a 12-year death data set that was looked at in Australia between 2001 and 2012. And they found that persons with occupations with access to firearms, medications, or drugs and carbon monoxide more frequently used those methods for suicide than those without access to means. And in fact, when they broke it down by gender, females employed in occupations with access to means had suicide rates 3 times higher, and men 1.2 times higher than those occupied in those employed in occupations without access. So we often hear when people talk about suicide, for example, among law enforcement officers, that the cause of death is often by firearm because of access to guns within their occupation. Similarly, we have data to support this in veterinary medicine as well. So when we look at the research that investigated suicides and deaths of undetermined intent among all veterinary professionals, so veterinary technicians and technologists, as well as veterinarians between 2003 through 2014, yes, they found that male and female vets were more likely to die by suicide than the general population in this subset. The rate or the comparison of male vet techs and female vet techs were also substantially more likely to die by suicide compared to the general population in that subset. But what was most important to highlight, or one of the biggest takeaways that came out of this particular analysis, was that when deaths including pentobarbital poisoning or euthanasia solution were taken out of the analysis, when all of the vets and technicians that died by those means were taken out of the analysis, in the veterinarians specifically, the rate of suicide did not differ from the general population. So again, what this tells us is that when we take away individuals dying by euthanasia solution, ingestion or injection, that there is, it really does seem to make the risk of suicide proportional or the same as the risk among those in the general population. Now, this was not true for the vet techs. Many of the vet techs died by drug overdose that did not include pentobarbital poisoning, but really important information for us to consider. Now, this is a lot of statistics, and I wanted to give you, a background of truthful, up-to-date statistics so that you can arm yourselves with the knowledge and capacity to be able to really discerningly look at some of the information that gets shared, and to be very mindful about what you share in turn, or even perhaps how you correct individuals when having these conversations. We'll talk more about the harm of misinformation later on today. But what I want to focus on, of course, for the rest of our time together today is, taking action, right? As I said in the title, we want to create hope through action. We recognize the statistics. It's important to acknowledge these statistics. And at the end of the day, these are just numbers. And just like in vet medicine, where we often say, treat the patient, not the numbers, we want to look at the people in our lives and not just focus on the statistics. So let's talk about warning signs for suicide. There are many, many things that we want to watch out for as we think really wholeheartedly about suicide prevention today. We want to look for individuals who might be really talking negatively about themselves, being really hard on themselves. I think we're all pretty hard on ourselves, but if you see this really amped up or repeated, this can be an indication of suicide. Expressing suicidal thoughts or intent. It is a myth that people talk about suicide just to get attention. That is simply not true. We know that when people talk about suicide, they are more likely to die by suicide. talking about death or having a plan to die, sharing final wishes or saying goodbyes, giving away possessions or settling personal affairs. So it could be, hey, if anything happens to me, I want you to look after my dog, or, I've got this, really amazing record collection. And if something happens to me, I want you to have it. Those can be indications that a person might be thinking of suicide. We also want to think about withdrawal, whether that's from the people in our lives, the activities we usually do, the hobbies that we have, that can be a sign as well. Noticeable loss of energy or appetite. So when you see people really stopping taking care of themselves, sudden change in appearance or self-care, I mentioned there as well. Definitely, challenges with sleep can be a huge indication of a person thinking of suicide, but also can be a trigger for individuals who are having mental health challenges. Those who live with mental illness are more prone to thoughts of suicide when they are not getting enough sleep. And then this is one of the biggest predictors. We think of frequent expressions of hopelessness or helplessness as being very much having the predictive capabilities of suicide. So if a person feels like, there's nothing, nothing left to hope for, or that there's no help for them, that nothing can be changed in their circumstances, that can be very concerning. Now, there are many risk factors for suicide, and the very top of the list you'll see there is mental health conditions. So, mental illnesses like depression, anxiety, and substance use are highly predictive of suicide, or put individuals at risk of suicide, would be the more accurate way to say that. And in fact, the research shows that amongst those who die by suicide, about 9 out of 10 individuals who die by suicide have a pre-existing mental illness. And we often don't talk about that. When we look at veterinarian suicide and how that's reported in the media, it's often, this person was the most amazing human, and they might have been, in the life of the party, and, they loved their job and they cared so deeply. And what often doesn't get mentioned is that they were living with a mental illness. And so I think that's something that we want to keep top of mind. If a person has attempted suicide previously, they are at greater risk of dying by suicide in the future. Chronic pain or serious illness, of course, major life stressors, whether it's loss of a person or a pet, relationship breakdown, divorce, separation, financial strains, filing for bankruptcy, losing a person's job, all of these can contribute as well. History of trauma or abuse, we know to be predictive of suicide in some folks. Limited social supports or isolation. This is why making sure that people know that you care, that help is available, is so important, because when people feel alone or isolated, or that there is no one to call, that is a risk factor. And then I already mentioned access to lethal means as well. Now, I really want to make sure that we're presenting a well-rounded view of suicide, and so we would be remiss not to talk about the protective factors against suicide. These include things like our strong social connections and our supportive relationships, access to mental health care and treatment. That's why stigma reduction is so very important. We want to make sure that people know that it's okay if you might be struggling and help is available. Having a sense of purpose. This is especially true for caregivers of pets, caregivers of children, caregivers of loved ones. Feeling a sense of belonging. This is why we often see protective factors in terms of belonging to a veterinary medical association among veterinarians can be a protective factor, because there is that sense, again, that I belong to this group, I am not alone. And then cultural identity as well. Positive coping and problem solving skills. If you've developed some of those resilient skills, you know what to do when life gets tough. You know what to do when your mental health is not doing well. And then restricted access to lethal means. And of course, supportive environments, whether that's a supportive work or practice environment, a supportive school system or environment, and having a community environment that is supportive can be very protective as well. So, how do we go about supporting our at risk colleagues or clients or friends or family members? Well, typically we think of gatekeeper training. So, gatekeeper training, the first training that we often think about is QPR. And I'm going to go into this in more detail in just a moment. But we generally think of this in three ways. Question: if you think a person is at risk of suicide, you ask them if they are thinking of suicide. Persuade. You persuade them that you care, people care, there's help available, and let's get them to help, which is the refer. How do we get them to the help that they need? Three steps. You do not need to be a mental health professional to be able to do gatekeeper training or QPR. Okay. So when we think about questioning, this is where we recognize, this is why having that knowledge of knowing those risk factors and warning signs is so important. Watch for that concerning behavior. I think so often in practice, someone might make a comment about taking the pentobarbital bottle home at the end of the day, or, they might be really struggling. They might be really not acting like themselves. And we might chalk it up to, oh, they're just joking, or, oh, they're just really, annoying to work with. I don't know what their problem is, but, we kind of cast them aside. We want to really take note of those situations, and we want to ask directly about suicide. And I'm going to give you some verbiage in just a moment. We want to do this in a very calm, caring, and non-judgmental way. We never want somebody who's thinking of suicide to feel judged. And this is why the language we use around suicide is so important. We really try not to say things like commit suicide, right? Commit is a crime. And having thoughts of suicide is not a crime. That would be like somebody committing cancer, right? This is an illness, and we want to give people the help that they need. So how do we ask? We ask directly. We don't beat around the bush. You're not thinking of doing something stupid, are you? That is not what we want to say. We say, I noticed you seemed really down lately. Are you thinking of suicide? Right? Demonstrate that we care. I care about you, and I want to understand how you're feeling. Now, if you're in practice or a work environment and you hear somebody make an offhanded comment, I would not call them into a conversation in front of others. I would take them to a private setting. We want to be gentle in the way that we ask, but we want to be clear. We do not want to mince words. We want to ask directly. And again, if they have a lot of feelings, we don't want to kind of shove it down. Oh, it's okay. Like, I'm sure you'll feel better tomorrow. Or, oh, like, don't say that. You don't really mean that. There's no judgment. There's no minimizing. It is, I hear you. I see you. I am so glad that you told me, right? So then we want to persuade, we want to encourage help. So this is where we express concern and a willingness to support. I don't want that to happen to you. I'm so glad that you told me help is available. Really emphasizing that seeking help is a sign of strength. This is not a weakness. So many of us in the vet profession, and I put myself into this category, we're so used to being caregivers. We're so used to helping others that it feels really uncomfortable to need or want help. And that has stopped me from seeking help for my mental health and mental illness in the past. And I have learned that just demonstrates my strength. That just shows how much I care about myself and about those in my life, that I am willing to get help so that I can feel better. Okay. So what kind of phrases could we use to persuade somebody, which is really just about encouraging help seeking? We might say, talking to a professional can help. You don't have to do this alone, or I'm here to support you in getting help. Again, really emphasizing this, validating emotions before offering guidance. So this is something where we want to really meet the person where they're at. If they dissolve into a puddle of tears and they say, yeah, I've been thinking so much about suicide lately, or I've been thinking a lot about, hurting myself or ending my life. We want to validate that. We want to say, wow, that sounds really hard. Like that, I'm so glad that you told me. Just be with them in that moment. We don't want to pressure them, right? We don't want to say, well, that's it. I'm taking you to the ER right now. But we do really want to encourage them, right? We want to make sure that they know that help is available. Okay. And then we connect them to resources, right? This is the refer piece of things. We provide information. You want to have this information ahead of time. Please do not wait until your client, your colleague, your family member, your friend is in crisis. Know the resources around you. And this is why I feel so grateful that here in Canada and in the US, we have 988. It's an easy number to remember. You can text, you can call, you will be connected to a mental health professional who can guide you as where to go next. However, in your area, or if this person has a previous history of suicidal thoughts, they might already be connected to a mental health service or professional. You might also opt to contact your employee assistance program, right? We won't get into the weeds of all of this today, and this is where 988 can really guide you. Many people have thoughts of suicide, some people every single day of their life. That doesn't necessarily mean they're going to be in imminent danger of death by suicide. What I mean by that is there are nuances in terms of whether a person has a plan and they plan to go forward with that plan, or whether this is a thought that they are having and we need to get them in touch with a mental health professional. So I don't expect all of you to be able to discern those nuances, but I will say that if you talk to somebody who is struggling and they say to you, I've been here before, I know what I need to do, then let them engage those resources, right? It might be EAP or Employee and Family Assistance Program. It might be their own counselor or psychiatrist, psychologist. It might be their doctor, okay? Offer to help make them the connection, maybe stay with them while they schedule the appointment, maybe drive them to their doctor, maybe, call the hotline together. We do want to maintain that connection and support. We don't just want to, okay, sounds like you've got this covered and then leave them to it. We want them to feel supported in the situation that they're experiencing. So again, I always find it helps me to have a little bit of, verbiage or some prompts in my head if I'm going to go into these conversations. And so you might say, here's a resource that you can reach out to, and then give them, whether it's a 988 or you might even have a local distress line in your area. I can help you make an appointment if you want. Okay. Again, following up to maintain that support, respecting confidentiality. So this is a little bit nuanced depending on your role with this person, okay? If you are in a leadership role, practice owner, practice manager, supervisor, boss, etc., you are going to need to be in the know, and you will be helping this individual. For members of the team, if you are an assistant, a client care representative, a technician or technologist not in a leadership role, I really do urge you to tell this person, I need to let somebody know so that they can help you as well, so that we can get a support system around you. That is going to be a big burden to carry on your own. And so especially if you have not done QPR training or some other form of suicide prevention training or mental health first aid training, you do want to bring somebody into the mix that will be able to also maintain that confidentiality, but also support this person. Now, it is important once we have this information, again, those of us who are, in a role to be able to support this individual, that we do respect their confidentiality. And if they ask that they want this information to be kept private, that they do respect that. Now, that privacy never prevents help seeking. So even as mental health professionals, myself as a coach, if I am with a client and they are indicating thoughts of suicide, that's not something I can keep confidential. Like, that is something that would need to be disclosed. Anytime a person is at risk of hurting themselves or hurting someone else, that is grounds for getting them to the help they need and disclosing that information. I'm talking more about sharing this information widely within the workplace or with others. Now, again, a lot of us have local resources in our area, local distress lines, local help centers. Know what you have available so that you can use that if you need it. And again, we want to make sure first and foremost that this person is safe. So again, access to crisis lines I've listed here, many other resources. Make sure that there is a plan. What is the plan for this individual? Are we going somewhere together? Are we making sure that they have an appointment and that they are going to get there, or that a loved one is going to meet them there? Making sure that, again, this person is not left alone and that we have a plan in place to get them to any of these many resources that we have available to offer them that immediate support that they need. Now, I mentioned that locally we have a lot of our own numbers. This is a fantastic resource here in Canada provided by the Canadian Vet Med Association, the Who You Gonna Call helpline phone numbers and websites. They've done a tremendous job of, for every single province, outlining what the local resources are. Some of these are local helplines. Again, anybody in Canada can call 988. Some of these are the Provincial Veterinary Medical Association employee assistance lines, or mental health support systems. So please take advantage of that if you are here in Canada. In the United States, there is also a really great resource on the AVMA website. You'll see a downloadable either color or black and white PDF that I urge you to post at your workplaces in the US, or you can have it available if you need it. You can use the QR code here to scan and access that, but that gives immediate access to crisis intervention when a person is at risk of suicide or another mental health crisis. Now, I want to recognize that we have friends not joining us live because it's the middle of the night for them, but watching the recording in Australia. And so I want to acknowledge that we have so many resources globally specific to the veterinary profession. In Australia, we have Thrive, which is the mental health and suicide prevention framework. Again, I've linked to that to check that out with the QR code. And then last but not least, across the pond, our friends in the United Kingdom have VetLife. VetLife has been around for a couple of decades now. It is a crisis line specifically for all members of the veterinary team, including students. You can call, you can talk to someone, various ways to get in touch with them, but that is available for you as well. Now, I want to take some time together while I have you today to dispel some of the myths, because this really is important to help prevent suicide. I think sometimes, when we don't have the right information, we can do harm. And so this is intended to help everybody. So I'm going to share the top 5 myths about suicide. And the first one is that people who talk about suicide don't actually follow through with it. This goes back to what I said before, where we talked about people using talk about suicide as attention seeking. And what we know based on the research is that almost all people who die from suicide talked about it at some point before their death. So we do want to take all statements about suicide seriously. It's much better to be overly cautious than to disregard the signs, okay? The second myth is that a person only attempts suicide or talks about suicide to get attention. And the sad truth is, and I've talked about this before, anybody who has a history of a suicide attempt has a much higher lifetime risk of dying by suicide. This is very pronounced in the literature. So although we might know somebody who has attempted and not died by suicide, if they are talking about it again, please don't think, well, they, didn't do it, they didn't die before, so I don't think that's going to happen again. Please offer help rather than assuming that you know what the reason is for their behavior or what they might be going through. Myth number 2, talking about suicide might influence someone to do it, right? We often feel like, oh my gosh, well, I don't want to put thoughts in their head. What if they're not thinking about suicide? And then I mention it. Is that going to give them ideas? We know that, in fact, remaining silent and ignoring the topic does nothing to help those that are contemplating suicide. It only exacerbates people's shame. We want to be willing to discuss the issue openly and objectively, so not judgmentally. We're just talking about this just like we talk about any sort of health concern or health problem. Okay. I can tell you that having had this conversation in terms of having to ask friends and loved ones about suicide before, the people whom I have had these conversations with have felt relief. They have felt um like, thank you so much for asking. Like, I'm so glad that you care enough to ask and that you're willing to talk about this with me, because they know that this is an uncomfortable topic, and that only makes it harder for them to bring it up. Myth number 4, if a person was previously having thoughts of suicide and appears to feel better, they're no longer at risk. In fact, what we know is that it's not uncommon for individuals who have been depressed or who have had thoughts of suicide to suddenly look much better. They look happy. They look, relieved and even upbeat. Sometimes this is because they have made a plan to end their life, and they do feel relief because they feel like, okay, I've figured this out, when in reality, they are still at risk. So please still check in with those folks. And again, myth number 5, once a person has decided to end their life, nothing will change their mind. We know, based on research from studying individuals who have survived suicide, that they are ambivalent. They're not sure until the moment leading up to the event. The majority don't want to die. They want to end their suffering. Okay. So there's a difference there. And it's really interesting because when we look at the research from suicide survivors who have jumped off the Golden Gate Bridge, every single one of them who was interviewed in a study said they regretted their decision immediately after they jumped. So again, chances are, when connecting with somebody, we want to be clear that, again, when people are contemplating suicide, there is a chance that you can make a difference in helping them. So, what is one thing that you can do to support others? Well, you can take a 1 hour suicide prevention training. So I recommend the QPR suicide prevention training that the American Vet Med Association offers. This is a 1 hour online training. It is open to anybody in the veterinary profession, free of charge. You can scan the QR code and get to the website here, and that will be available for you at any time. Okay, I've done the training a couple of times, highly recommend it. Please do check that out. There is also an Ask Suicide Prevention training that is available from Vetfolio. This training is about 35 minutes long. It shares veterinary specific scenarios in the training, so it's a little bit shorter. Again, this maybe is something that you could do as a team. Highly recommend doing these trainings with other people so that you can process it, you can talk about it, you can, commiserate about what you're learning. This could be something that you could do as part of your staff meeting. You could do it during September, the month of September, which is Suicide Prevention and Awareness Month. So highly recommend checking that out. What is one thing that you can do to support the veterinary profession? Well, I want you to come away from our time together today being very mindful about the information you share regarding suicide among veterinary professionals. We know that suicide contagion is a real thing. What this means is that when a person is vulnerable to suicide and is exposed to suicide, that will increase their risk of suicide. So anytime suicide is reported in the news, on social media, talked about in conversation, when there are vulnerable individuals around, they are at higher risk. We know this is especially true among people who work together. It is also especially true among communities. So we think of Indigenous communities where suicide contagion can lead to clusters of suicides among especially Indigenous youth. This is particularly concerning, again, for young folks, for people in the same peer set, and for people who work in the same industry or space. So that means us as veterinary professionals. So, how do we communicate safely about suicide? We try to use neutral language. A person died by suicide. Again, we don't say committed because of the criminal connotation. When we share about suicide, we want to share hope, help, and resources. We want to keep the focus on support and recovery. What we don't want to do is share any details about the suicide or the means or the methods, and we don't want to glorify or sensationalize the act. So we don't want to make a bigger deal about a suicide death than we would about a colleague or a friend that dies from cancer or dies from a heart attack. We want to keep the means of death and the death itself, the conversation around it, we want to treat it the same. Okay? So this is what we don't want to do. And these are some examples from mass media using words like shocking, again, is amplifying it. Calling suicide an epidemic is also amplifying that, especially when we link it with veterinary professionals. Staggering statistics. Again, we want to be very careful about the language that we are using because we don't want to make this feel inevitable. We don't want this to be more than it is. And as an advocate for suicide prevention, I never want to discourage conversations around suicide. I want us to talk openly about it, but we really need to be mindful that we are being accurate in what we share as far as numbers and as far as risk factors. So when it comes to social media, this is so important. Over the years, I have been so happy to see more and more people talking about mental health and suicide prevention, but I have also been very, very concerned about the way in which we have been sharing this information from time to time. When we share social media posts, we want to be sharing resources. We want to be sharing 988 crisis hotlines, telling people to get help, telling people that we care about them, that support is available, that, help is out there, that treatment does work. What we don't want to do is we don't want to perpetuate photos, especially photos that appear where people appear sad or despondent or upset or alone. Any sort of, certainly not sharing any suicide notes or dramatized stories. What's really important that we don't do as well is to speculate about motives. We see this a lot in the veterinary space where we say, so and so had a client that yelled at them and that led to their suicide. We don't know what led to a person's suicide. If the family approves it and if a suicidologist or a suicide autopsy specialist is available, they might be able to look into that. But I can tell you with certainty that the media doesn't know, that the peers don't know, the colleagues, because that sort of investigation takes looking back into a person's childhood, their school records, their health records, interviews with all of their friends and family and peers. It is an exhaustive process. And even then, oftentimes we don't know what it was that led to the suicide. And of course, if there's anything unverified, like maybe this person had gone into debt or maybe this person's license was being revoked, we do not want to speculate on that information. So this is an example of a helpful post about suicide. So this was shared after a veterinarian's death by suicide a few years ago. And you can see here that this statement simply is, we really don't know what people are going through, right? We can't make assumptions. But if you are struggling, here's how you get help. And this was before 988 was available. So we've got the Talk Suicide line in Canada, the Canadian Association for Suicide Prevention, the Kids Help Phone. This is what we want to share. These are the messages that we want to bring to the masses. So if you're interested in learning more about safe reporting on suicide, there's many, many resources. There are organizations that are passionate about changing this, especially given the amount of sharing that happens on social media. You can go to reportingonsuicide.org or you can go to suicidepreventionmessaging.org. Now, what is one thing that you can do for yourself? Okay, let's talk about that. I want to urge everybody. It doesn't matter if you're having thoughts of suicide. It doesn't matter if you have a pre-existing illness, mental illness or not. You can benefit from speaking to a mental health professional, especially if you're feeling overwhelmed by your emotions or that there's emotions that feel persistent, you can't shake them, or if your emotions are interfering with your daily functioning, whether that's your relationships at home, whether that's your work functioning. Talk to somebody. I can tell you, as somebody who lives with depression predominantly, and I do have instances of anxiety and panic disorder as well. What I can say is that, I can feel sometimes like I've got the tools, I've got the strategies, I'm taking my medication, I'm doing all the things, and push my way through it. But there's times too where I don't need to push my way through it on my own. I can talk to somebody, and all it takes is, sending that email, sending that message, making that phone call, however it is that you need to do to get in touch with your mental health provider. I have used the employee assistance program through the Alberta Vet Med Association. I've used private counseling. I've used many different means, including my doctor and a psychiatrist. Use those resources. And I wish that we had more resources. I wish all of those resources were free. Of course, they're not. But if you are having troubles finding resources for you, especially resources that are free, please reach out to me and I will be happy to link you up with the resources in your area. Now, I do want to mention as well that the American Vet Med Association did an incredible job putting together a very exhaustive document that you can access here, that is a suicide prevention resource guide for veterinary settings. They take you through all of the things I've talked about, the warning signs, the risk factors, how to have conversations, access to QPR training, ways that we should be talking about suicide in the workplace. Please download that and give it a read through if you haven't already. So once again, I want to leave you with the message that if you or anybody you know are having thoughts of suicide, to please know that help is available and that you are not alone. And you can call or text 988 or visit findahelpline.org. And Jamie, one of my incredible team members who is very active with Not One More Vet, as a lifeboat volunteer and with the Kids Help Phone as well, has just messaged me. She said, as someone who volunteers on the crisis text line with Kids Help Phone, I think it's important to highlight that the text line is available to all ages, in chat and phone counseling available for anyone under 30 years old, and is available in over 100 languages and free. So thank you so much, Jamie, for providing us with that resource. And I will be sure to include that the next time that I present this information. Incredibly helpful. I had no idea. For some reason, I thought Kids Help Phone was 18 and under, but it's so good to know that it's 30 and under. That's a tremendous resource. So again, key takeaways that I want you to share and to spread with others. This presentation will be available for rewatch. So have your team watch it together, share it with others, make this information known that suicide is a global and a veterinary concern, and awareness saves lives. We want to recognize the warning factors, the risk factors, and the protective factors. We want to be able to take a suicide prevention training so that we can support others in the profession as well as other people in our lives. Know your local and global resources, and please, when you are sharing information, make sure that it is safe, neutral language, hope-focused, avoiding myths, and avoiding sensationalism. So I mentioned that I have a personal, focus and desire to advocate for suicide prevention and mental wellness. I included an entire chapter on this in my book, A Compassionate Calling, What It Really Means to Be a Veterinarian. So I talk about suicide in the veterinary profession. I talk about all of the statistics, the history of when we started talking about suicide in the profession, and all of the incredible organizations that are doing work to help support veterinary professionals and to prevent suicide amongst those of us in the profession. So please do consider accessing that as well. So we have come to the end of our presentation. I'm going to move through a few more housekeeping items. While I am doing that, I would love for you to please share any questions or comments that you have in the chat. And I'm just going to open up my notes here. So again, thank you so much. It has just been so wonderful to be here with all of you today. And thank you for those of you who are watching the recording as well. Please distribute this widely. This is such an important conversation, and you being here and being dedicating this hour of your time to this very important topic is just truly inspiring. So thank you so much for that. A quick reminder to everybody who watched live, you are eligible for CE credit. You will receive an email within the week with your CE certificate from the Alberta Vet Med Association. A recording of this webinar will be available on our YouTube channel at Reviving Vet Med. Subscribe to our channel so that you don't miss those things. And again, lots of different resources available on revivingvetmed.com. I also hope that you will join us for our next webinars and events that we have coming up. So in the month of October, we will have a panel discussion, Living with ADHD and Working in Veterinary Medicine. We have our ADHD coach, one of our facilitators and well-being advocates who lives with ADHD, and a dear friend of mine who is an ER doctor and criticalist in DC. She will be joining us as well on that panel. On October 15th, sponsored by Purina, we have Thriving as a Veterinary Technician, Overcoming Challenges and Enhancing Well-Being. This is in honor of course, RVT Month or Vet Tech Appreciation Week. And then on October 22nd, sponsored by Trupanion, we have Navigating Moral Stress in Vet Practice, Reframing the Cost of Care Conversation. So please do take advantage of those. If you scan the QR code, that will take you to our newsletter. Every single month, we have a newsletter dedicated to a particular topic and a newsletter sharing these events, all of which are free to attend. So please do take advantage of those.